Welcome back for more physiology. In this particular talk, we're going to deal with cardiac control. So how do we control the heart? We're going to do that by answering a question of why do you feel lightheaded if you stand up too quickly? As a refresher, we have two different paths of circulation, one that goes to the lungs, one that goes to the rest of the body, what we call the systemic and the pulmonary circuits. If we look at this and think about it logically, what we can claim is the amount of blood that goes through the systemic circuit should be the same amount that ends up running through the pulmonary circuit, since it's a complete loop. What we also need to remember is the role of the heart is to provide pressure, and that pressure drives blood all the way through. So if I don't have blood going into the heart, I don't have anything to eject out, and thus I don't have any pressure. One of the questions that we should ask is, well, how much blood do you actually pump every minute? That term is referred to as cardiac output and has two components. The first one would be your heart rate, so how many beats you have in a minute. The second term is something we've never dealt with before, and that is your stroke volume. How much blood do you squirt out of your heart? How much blood do you eject from your heart in every single heartbeat? It turns out if I were to multiply these two values, I end up getting cardiac output. So when I look at the two systems, we know that the same amount of blood ultimately runs through both. The question is, well, how does the cardiac output differ? And the answer is, it doesn't differ at all. If the same amount of blood needs to flow through both sides, the cardiac output of the left side of your heart, which is the systemic circuit, which is about 5,000 milliliters per minute, is going to be the exact same as the cardiac output of the right side of your heart, which leads to the systemic circuit, or the pulmonary circuit, which is to say about 5,000 milliliters per minute. They are going to be the same. Well then, how do we change cardiac output? How can we increase it and how can we decrease it? Well, there's two ways, one of which is we can use the brain to influence it, and we can do that using something that we've referenced before called the autonomic nervous system. Or what we can do is we can use a far more fundamental, far more logical trick. And that logical trick is this. If I have 5,000 milliliters of blood leaving the heart every minute, how much blood must enter the heart every minute? And the answer is 5,000 milliliters. If I increase the output to 10,000 milliliters a minute, I'm an elite athlete, how much blood needs to return to the heart? The answer is 10,000 milliliters per minute. Well, how can we increase the cardiac output? The stroke volume can only change so much, which means the only thing that we can really fluctuate would be the heart rate. So what I'm saying, by us just playing a little bit of logic, is if I have more blood returning to the heart will automatically move more blood out of the heart. Well, how can we get more blood to the heart? That's a phenomenon referred to as venous return, using what we would call muscular pumps. It turns out if you look at muscles in your body, sandwiched between muscles, you will find veins. And whenever muscles get used, exercise, the muscle shortens and becomes fatter, which will compress the vein, and it will force blood to move back towards the heart. It never flows backwards once the muscle relaxes because we have valves, and the job of the valves is to not let blood flow backwards. So what we should see is a high volume of venous return should correlate with a high volume of cardiac output, and that's exactly what we turn out to notice. Physiologists give this a name, and what we'll notice is with cardiac output increasing with more blood entering the heart, what we would call the end diastolic volume, we'll get an increase in cardiac output by increasing stroke volume, but we'll also increase, so stroke volume because there's more blood in there, and we'll also increase heart rate. This phenomenon is referred to as the Starling law, or Starling's law, or the Frank-Starling law of the heart. And it's rather logical, which leads us to the question that we're trying to solve. So when you stand up quickly, why do you feel lightheaded? To do this, I can give you 3 pieces of information, and then you can answer the rest. The first one is water is very heavy, and blood is basically water. The second thing is your brain, when it doesn't get what it wants, it feels dizzy. The third one is if you are asleep and you're actually asleep in bed, before you wake up, you start to shake, you start to stir. And what you're doing is you're probably using those muscular pumps. We're actually increasing venous return. And with those 3 pieces of information, you can solve this puzzle.